All right, let's get started. Hopefully you got your little bacon and eggs or your bagel and your donut or whatever you're doing at your house, okay? So here's a handout that I use with many students, and it's exaggerated, totally magnified, ridiculous, super ridiculous, but that's okay because it's going to teach you. We know that the first step is the basics of EKG, or the basics of telemetry, is looking at the rate. So if you think about the basics of this EKG, you have to look at the rate and the rhythm, right? Those two are just basics. And I find it's easier just to teach the student the rate real quick because they always get it. And so you get these spiky little things here, and you see 1, 2, 3, 4 spikes. If you think about the tops of the spikes, those are your R's. If you think about the tiny little mountain right behind the R's, and hopefully you're seeing this easily, there's a P, there's a P, there's a P, and there's a P. Now, what is it about the P wave? It's small. It's usually more rounded. It's a lot shorter than what comes after the QRS. It's extremely predictable. In fact, we say P for predictable. P for predictable. It's almost always there, and if it isn't, all you have to do is say, oh, could be AFib or a flutter, because it's almost always behind the QRS. Now, QRS, you're going to hear me say that a lot. It's true, the spikes at the top are the R, but the whole ziggy-zaggy thing is really a QRS. I hope that makes sense. Now, I'm gonna flip. Don't flip out over there. I'm gonna flip. Here we go. Flip. So here you see another normal EKG. And on this EKG, it's even more accurate. And what's at the top? R's, right? Boom, boom, boom. How many R's? 1, 2, 3, 4, 5, 6, 7. Well, you know how this goes. This is based on a 6-second strip, right? 6-second strip. How many of those does it take to make a minute? 10. 10 times 6 is 60 seconds. So if this is based on a 6-second strip, then 1, 2, 3, 4, 5, 6, 7. 7 times 10 means that this heart rate is 70. I bet not have lost any of you, because that was kindergarten or even preschool. So stay with me. So here we have a 6-second strip, a heart rate of 70, because that's how many R's you have. Now let's have a little bit more fun. Let's go deeper, shall we? Let's look at the space between those R's. Now for that purpose, I'm going to show you my colorful copy. Hold on. Here you go. I did it, y'all. I did it. I colored my R's on here. You can see that the yellow R's, 1, 2, 3, 4, 5, 6, 7 R's, makes this a 70 beats per minute strip. But let's go a little deeper. If you measured, and you're not, because most tests don't require you to measure, but later we will. We'll get more complex as we go. But for now, if you measured and just kind of measured it by looking at it, like, oh, look at that. That's what I need you to do. If you just looked at it, if you were honest, you could say the spaces between the R's are exactly equal. There is no big space on one and a tiny space on another. No, it pretty much looks really equal. That's how you can determine the regular rhythm of a strip. If the space between the two R's, or 2 R's, 2 R's, 2 R's, if that space between those R's is literally equal, then we say, oh, that's a regular rhythm. So right now we have a lot of information. We know it's a regular rhythm. We know that the rate is 70. And then we know that the R's look like they're normal. Now we don't know what normal is yet, but you will. So let's go a little deeper. Let's do the P wave, right? We got the P's. And what did I do? I colored those blue because I told you to be systematic in your note taking. So the P's are blue. And when you look at the P's, there's supposed to be a little tiny hump before the big ziggy-zaggy thing called an R or QRS. And the P's are there. What did we say about P's? They're predictable. Here's another tip about P's. For your purposes and mine, the P must come immediately before the QRS. It can't be down the street picking up some cigarettes. It can't be over across the way looking at the Browns game. No, it's got to be hugged right up against the QRS. Y'all with your girl? I hope so, because, you know, I'm over here shaking hips and things, and I'm too old for this in a way. Okay, so here we go. P is very much immediately before the QRS, and the R is at the top. So what's down here? A Q. Where is it? Right as the QRS starts, or this R zigzag pattern starts, that's where the Q is. So you have your P, your Q, your R, and then you get a little bit of a break. It's not like with the P up against the QRS. There's a little bit of a break, and certainly the R comes down. When the R comes down and hits the baseline, it's basically called an S. Yes, that'll be important later. And then you have a bigger mountain right after that zigzag QRS pattern. That bigger mountain, of course, is a T wave. So if you know your alphabet, which again, we're talking preschool, you know how this goes. P, QRS, T. P, QRS, T. P, QRS, T. And my God, isn't that a nice normal strip? So let me show you without the colors what we're saying. So you have this normal sinus rhythm with the P, the Q, R, S, T. It's not colored, but it's very, very clear. You remember that original strip I showed you a bit ago before I flipped out to this one? Let's flip back to that one. You may not have this handout, but stay focused with me, please. Remember how I said this was extremely exaggerated, and we're going to be using this later, but it's extremely magnified and exaggerated. So much so that actually this would not be necessarily normal, but it is today. So let's look and see what we're making out of this strip. P, Q, R, S, T. Did you see that? That's it right there. It doesn't matter what strip you look at. You have got to start with the rate, the rhythm, and the P's. Okay, the P's are predictable. Now, let's go a little bit further into talking about rates, right? You and I both know that a heart rate less than 50 to 60s is a bradycardia. Most of us would say under 60. Some would not worry too much in the 50s, but I need you to know definitions. So a heart rate technically less than 60 is going to be considered a bradycardia. A heart rate greater than 100, and in my day, because I'm old, I graduated in the 80s, we used to say a heart rate greater than 90s. But now the definition is a heart rate greater than 100 is tachycardia. And I would caution you to understand a little bit more about tachy rates. I would say a heart rate 110 and higher makes us a little nervous, shall we say, because there's got to be something really, really wrong with why that heart rate is that high. But you get it. We're talking basics here. We're talking P, Q, R, S, T, right? And we're talking what's the normal heart rate if you're going to look at the rate early in the basic process. What's the normal heart rate? Well, the normal heart rate is 60 to 100. And so going all outside of that range is going to make us kind of nervous. Now, your patient, boy, your patient may have done any number of things in their wonderful lifestyle, or just even we as providers may have done a number of things to create the problem in the first place. So if it's us, it's probably medications. If it's the patient, it could be lifestyle. You know, the whole cigarette, stress, oh, I like 5-hour energies every other hour. I mean, you know, people do crazy things. And so you want to consider that it's, that heart rate is impacted by a lot more than just what's happening today. All right, now that was the basics. Hope you got something out of it. And now we're going to dig deeper. Talk to you later. I want to see how close.